Hi, I'm Blake Simmons from Vision Institute in Colorado, and it's an honor for me to present the results of the ATLAS continuation study on behalf of my co-authors. The ATLAS continuation study is a continuation from the ATLAS study that was presented at last year's ARVO meeting and was intended to determine the impact of Demodex blepharitis on patients. Below are my disclosures. Demodex mites are the most common ectoparasites on humans. And because Demodex are very common in low numbers, they have been largely ignored as human pathogens. Mites exist in various environments on the body. And when there is an overpopulation of mites, as evidenced by collarettes on the eyelashes, they may go from having subclinical impact to causing inflammation and a variety of diseases. On the eyelid, they've been implicated in blepharitis and meibomian gland disease, or MGD. On the skin, mites are associated with conditions such as rosacea and acne vulgaris. There are two species of Demodex that affect the eye: Demodex follicularum, which we'll focus on in this presentation, feeds on sebum and follicular epithelial cells, and are often found clustered as inhabitants of the lash follicle. Demodex brevis, the shorter and more solitary mite, typically hangs out in the meibomian glands. I see Demodex blepharitis frequently in my patients of all ages, and in those presenting for surgery. Many of these patients share that it impacts their daily activities significantly, from being concerned about the appearance of their eyes to their eyes feeling itchy and dry, and even affecting nighttime driving. Therefore, it's important to look for signs of Demodex in all your patients. In fact, I check for them in every eye exam. And here's how I do it. I look specifically for collarettes, which are the pathognomonic sign that a patient has an overpopulation of Demodex, or Demodex blepharitis. Collarettes are waxy excretions that form a cylindrical collar around the base of the eyelash follicle. They are composed of accumulated undigested material, keratinized cells, mite eggs, and egg casings. Studies have confirmed via epilation and molecular technique, or PCR, that Demodex mites were found on all lashes with collarettes. Before I reveal the results of this study, I wanted to share some tips on how I and other investigators in this study recommend looking for collarettes with a slit lamp. Here are some images of what you would typically see if a patient was looking straight ahead. And below that, you can see the same patient looking straight ahead with a lid lift. Looks normal and healthy so far, right? Now look at this same patient's lids on the right side. Wow, that's so easy to see, but would have been missed had we not asked that patient to look down during their slit lamp exam. That's all it takes to confidently diagnose Demodex blepharitis, and you already have a slit lamp in your office. The purpose of the ATLAS study was to determine the impact and burden of Demodex blepharitis on patients' visual function, daily activities, and motivations for seeking care. Previously, data on 311 patients from 8 eye care centers was presented. Here, we present results from continuation of that study, now with patients recruited from 20 optometric and ophthalmic centers in the US. The investigators counted mites, looked for collarettes, evaluated for lid margin erythema, and patients with all three were asked to complete a questionnaire about their symptoms, daily activities, and Demodex blepharitis management experience. A total of 524 patients qualified for this study and were analyzed. 57% were female, and the mean age was 66. We discovered our patients were being impacted by the disease, but they're not being diagnosed. 68% of these patients have been experiencing signs and symptoms of Demodex blepharitis for over 2 years. 32% of these patients have gone to see their eye doctor at least twice. 20% have gone at least 4 times, and yet 59% have never been diagnosed, even with blepharitis, not to mention Demodex blepharitis. This is why it is so important to have patients look down during their eye exam, and for every eye doctor to look for collarettes. Our patients were asked to rate their top 3 symptoms, and the most commonly reported were itchy eyelid and dry eyes, followed by foreign body sensation and irritated or burning eyes. This is an interesting graph that shows how Demodex blepharitis affects patients on a daily basis. You can see that the most common burden on patients is difficulty driving at night and self-consciousness of knowing their eyes itch, or negative appearance of the eyes. They've also stated that they need additional time for daily hygiene. Notably, a few mentioned contact lens discomfort as well. Overall, 77.4% of patients said the disease negatively affected their daily activities. Since there is no FDA-approved prescription treatment, Demodex blepharitis patients report trying artificial tears, lid wipes, warm compresses, and many other management approaches for their symptoms. This shows that there is an unmet need for prescription treatments that have established efficacy and safety. We also delved into the small contact lens wearing population from this group. Although the contact lens wearers with Demodex blepharitis was a small sample of the overall study population, 64% reported that they noticed blurred or foggy vision, and 64% reported that they had discomfort at least sometimes to frequently. Separate studies of larger populations would be beneficial to validate the effects of Demodex blepharitis on contact lens wearers. Results from this Atlas continuation study, a continuation from the original Atlas study, affirms data presented previously. Looking for collarettes by having patients look down at the slit lamp is a simple way of quickly and confidently diagnosing Demodex blepharitis. Many patients with Demodex blepharitis made multiple doctor visits and went for years without a proper diagnosis, negatively impacting not only the patients, but also the healthcare system. They reported itchy eyelids and dry eyes as the most common symptoms and tried a variety of options to manage their symptoms, as there are no FDA-approved prescription treatments available. We found burden and functional impact on patients with Demodex blepharitis. 77% of patients said the disease negatively affected daily activities, from feeling self-conscious about their eyes to nighttime driving and difficulties with lid hygiene and makeup. A new subgroup analysis in this continuation study of 14 contact lens patients showed a negative impact with blurred or foggy vision and discomfort, revealing a need for further study in this important patient group. Thank you.